Hello, my name is Jennifer Shoskes, and I am the Patient Advocacy Specialist for Capricor Therapeutics. Thank you very much for having us at this meeting. We're really thrilled and honored to meet you, the members of the community. You're the reason that we do what we do. We're a public company as well, so this is our notification that I may make forward-looking statements in this presentation. So our product is called CAP-1002. It's a biologic product consisting of allogeneic cardiosphere-derived cells derived from donated heart muscle. We get donated heart and we grow the cells from the hearts. They're not stem cells, but they are similar to stem cells. They do not act by stemness. They don't engraft into host tissue. Instead, they release extracellular vesicles, or exosomes, containing non-coding RNA and proteins. They're internalized by target cells, and they stimulate diverse and long-lasting changes in cellular behavior. The cells act like a delivery truck in that they are distributed in the body and they release the payload, or what we call the extracellular vesicles or exosomes. The cells are immunomodulatory, they limit fibrosis, and they promote tissue regeneration. CAP-1002 has been investigated in several clinical trials and more than 130 human volunteers. This slide shows the downstream effects of dystrophin deficiency. Many preclinical studies and early phase clinical studies indicate that CAP-1002 helps to modulate the effects listed in orange on the right, such as reducing inflammation, limiting fibrosis, and increasing blood flow. So we also did some preclinical studies with the MDX mice, as some of the other companies did as well. In the figure on the left, we were measuring ejection fraction. That's a measure of how hard the heart is pumping. And the MDX mice were injected in their hearts 2 times with our product CAP-1002. They were given doses at baseline, right here, and at week 12, right here. So the bottom line are the MDX mice that were treated with placebo. The middle line are the MDX mice that were treated with CAP-1002, and this top line, that's our control group. So as you can see, we saw a bump in ejection fraction right here after the mice were given the first CAP-1002 treatment. And then again, right here, we saw another big bump in the ejection fraction after the mice were given the second dose of CAP-1002. This shows improvement in the cardiac function. In the figure on the right, the mice were placed on a treadmill, and we measured the distance that they walked. They were only treated once, and they were also injected with the CAP-1002 right into their heart muscle. So again, this bottom line, this is the mice that were treated with placebo. The middle line is the mice that were treated with CAP-1002, and this top line is the control group. So there was actually a really big bump right here in the distance that the mice walked after being treated with CAP-1002. In fact, the distance that they walked on the treadmill actually doubled. This was more than you'd expect to see if the CAP-1002 was only affecting their heart muscle. This made us want to investigate CAP-1002 on skeletal muscle as well. And this is the data that led us to initiate the HOPE Duchenne trial. So this trial finished in 2017. The results were presented at the American Heart Association in November of 2017, and they can be found on Capricor's website. This was Capricor's first DMD trial with CAP-1002. The trial had 25 patients. They were ages 12 and above, so our study is for older boys. They had to be on a stable steroid regimen in order to be involved in the trial. They had to be on the steroids for at least 6 months. They also had to have confirmed cardiac scar in their hearts, confirmed by cardiac MRI. And it was an open label, very cardiac focused trial. So the patients knew if they were being treated or not. They were randomized either to one treatment of 75 million cells of CAP-1002 or usual care. If they got the CAP-1002, it was a one-time multi-vessel intracoronary delivery of 75 million cells, meaning they went into the cath lab and they had a cardiac cath procedure where we injected the cells into their heart, 3 different places in their heart. Month 6 and month 12 were our analysis time points. There were also other study visits throughout the trial, and we had both safety and exploratory efficacy endpoints, which are all shown here. We had sites at University of Florida, Cedars-Sinai Medical Center, and Cincinnati Children's Hospital, 3 sites in the US. And this chart down here shows the baseline characteristics of the 2 different groups. They were similar. The baseline characteristics for the usual care group and the treated groups were fairly similar. One thing to note is that the usual care group had a little bit more scar to start, which is shown here. They had more scar than the 17.6. Also, the CAP-1002 group had a little bit more muscle impairment at the beginning of the trial, which you can see by the fact that 77% of the boys were already non-ambulatory before the trial started. We also saw this in the pool scores as well, which you'll see in a minute. So these are some of the results from the Hope Duchenne trial. And here we were measuring the cardiac scar. It was done by cardiac MRI, and it was done by a measured blinded independent core, or it was measured by a blinded independent core lab. So what you see here, the blue group is the placebo. So at the 6 months mark, we're measuring the change, percentage change from baseline of the size of the scar. So here's the placebo group at 6 months, and as you'd expect, there's not much change in their scar. This is the placebo group at 12 months, and as you'd expect with Duchenne, their cardiac scar actually increased, as the natural progression of the disease does. The red group is the CAP-1002 group, and at 6 months, the scar in the heart decreased just a bit, and at 12 months, the scar decreased even more, and it reached statistical significance. These results showed us that there were changes in the structure of the heart. What you see here are the results of the wall thickening measurements. So wall thickening refers to the change in the thickness of the heart when it's pumping, when it's contracting. The greater the thickening, the better the heart is performing. So we measured thickness in a variety of different areas around the heart, and we saw improvement in the treated group as compared to the usual group. These results show changes in the function of the heart. And since we saw a direct effect on skeletal muscle in the preclinical mouse models, we also measured the effect of CAP-1002 on skeletal muscle in the HOPE trial. Since so many of the participants were non-ambulatory at the start of the trial, the 6-minute walk test wasn't very helpful, so we used the performance of the upper limb, or the pull test, to measure the effects on the skeletal muscle. As most of you know, or if you're familiar with it, the pull test is designed specifically for patients with Duchenne muscular dystrophy, and it measures their ability to perform common tasks of daily living, like turning on a light, or bringing their hand to their mouth, or picking up coins from a table. Since our baseline patients were a little further advanced in disease progression, they'd already lost a lot of their shoulder function. Normally, pull is measured in 3 areas: at the shoulder, at the elbow, and at the hand. But what you're seeing here, because so many of our patients had already lost their shoulder function, these results show the middle or the elbow level and the distal or the hand level. Significance wasn't reached, but we did see trends toward improvement through the follow-up. And some of our patients did see skeletal muscle improvements. So in HOPE, we saw signals of improvement in both cardiac and skeletal muscle function. CAP-1002 was generally safe and well tolerated by the boys. And we believe that to get sustained benefit, it will likely require repeat dosing. In HOPE Duchenne, they just got one single dose. So this leads us to our next trial, which is HOPE 2. So HOPE 2 is, the objective is to evaluate the safety and efficacy of intravenous CAP-1002 administered every 3 months in subjects with Duchenne muscular dystrophy and impaired skeletal muscle function. So the boys will go through screening. It's a phase 2 randomized, double-blind, and placebo-controlled trial for patients 10 years or older. So again, this trial is for older boys. They have to be at least 10. There's no upper limit. They could be any age on the high point. Once they're screened, they'll be randomized 1-to-1. That's like the flip of a coin, either to CAP-1002. If they get CAP-1002, it will be 150 million cells in each infusion, and they'll get one infusion every 3 months. Or they'll be randomized to placebo, where again they will get an IV infusion every 3 months, but it will be of placebo. So this shows the study visits, where the doses take place. There's a week 4 visit. There's also a month 12 visit where we conduct some other tests where they're not actually receiving dose. And they'll receive a total of 4 doses throughout the period of the trial. There will be about 6 to 7 site visits, and the trial will take approximately 13 months. And we're going to enroll about 84 participants over 10 to 15 sites across the US. Again, this infusion is by IV. It's not a cardiac cath procedure like before. It's much more simple. It's not an overnight hospital stay, and the procedure should take about 30 minutes. So we're measuring a variety of efficacy and exploratory endpoints in this trial. Some of them are listed here. The FDA has made it clear, the FDA in the US has made it very clear that there are no approvable cardiac endpoints. So we are still going to look at cardiac effect, but our primary endpoint is going to be the upper limb function at month 12 as measured by the pull test. Here are some of our key eligibility criteria. To be eligible, the patients must have a genetic confirmation of Duchenne muscular dystrophy. They don't have to have any specific mutation. They have to have reduced upper limb strength as measured by the pull, a reduced ability to walk or run, and they must be on steroids for at least 12 months and a stable dose of steroids for the previous 6 months. Some of the key exclusion criteria are also listed here on the bottom. Something to note, if a boy is over 18 years of age, he must be non-ambulatory to participate in this trial. And for more detailed eligibility criteria, you can find us at clinicaltrials.gov. So we are currently actively screening patients for HOPE 2. Our first patient was treated in April of this year, 2 months ago. And so far we have 2 currently enrolling sites. One is the University of California, Davis, and the other is the University of Utah. Dr. Craig McDonald is our overall PI for the trial, and he's located at UC Davis. And we're expecting to open many more sites in the summer of 2018, this summer. Currently, we're only enrolling patients in the United States, but it is absolutely in our plans to consider expanding outside of the US in the future. Some considerations: ambulatory and non-ambulatory young men and boys are considered for enrollment. The trial requires 4 IV infusions. We're estimating there will be 10 to 15 clinical sites across the United States, and we have a robust travel policy to help reduce the burden on patients and their families. You can get more information, again, at clinicaltrials.gov. We also have a website, hope2trial.com, with some more information there. And as new sites open up, it will be announced on those websites. Again, thank you so much to Little Steps for having us today, and all these other organizations and our DMD advisory group.